um, Instagram. We thank you for joining us. But I want to give you a telephone number tonight, so you can join us. 857-9641. And then we're on Facebook at East Orange City Hall also. So we thank you. So again, our panel tonight is Dr. Monique Griffin and Victor Coute from our health department. And they're going to give some updates tonight on the vaccine and the eligibility requirements. Also, we're going to talk a little about our mobile health clinic and where the vaccine sites are, because I know that folks have been calling and reaching out. And we're trying to make sure that we do everything we can to make sure folks have information. So again, what I want to do, let me give out the numbers. We always want to give out the numbers. As of today, March 17, 2021, we have confirmed 5,718 positive cases in the city of East Orange and 276 confirmed of deaths. In our first ward, we have 934 cases. In our second ward, we have 945 cases. In our third ward, we have 1,089. In the fourth ward, we have 1,033. In the fifth ward, 1,164 cases. In Essex County, there are 72,052 positive cases and 2,456 resulted in deaths. In New Jersey alone, the positive cases are 751,082. 21,530 resulted in deaths. So again, as we have been really enforcing, please keep those masks on. Please continue to practice social distance. Please continue to stay vigilant. And please continue to wash those hands frequently. Look, we know that folks are starting to take the vaccine, but we cannot take that for granted. You know, we hear it every day from our governor. We hear it every day from the CDC. We hear it from our local government, and now you're hearing it again from your mayor. We're asking everybody to please stay vigilant. Do not go out here after all the hard work and all our dedication and we go back into where we was at. We don't want that. We don't even want to mention that tonight, right? But we want to make sure we stay focused in terms of to the numbers drop all the way down. We're getting there, but it's going to take a while, guys. It's going to take a while. So what I want to do tonight, because Dr. Griffin is on the line, again, she's up at St. Matthew's Church, really pushing this vaccine with FEMA and the county, along with Victor Coute. So, but there's so many questions that people have been asking in the last couple of weeks. So I'm going to go right to Dr. Griffin on the phone. Dr. Griffin, how you doing this evening?
I'm doing well, Mayor.
That's good. So, Dr. Griffin, I know that you've been hard at work for the last really a couple of weeks when doing this vaccine and making sure people, the appointments and people are taking this shot. And I know that sometimes it can be very tedious, but we all really thank you for all the hard work that you and Victor and your department do in terms of allowing folks to be able to take this vaccine so we can get back to some normalcy. But I do want to ask you a question, Dr. Griffin. We have been ramping up our vaccination plans over the past few weeks. Please provide an update on our vaccine efforts.
Absolutely. So, thank you, Mayor, and even the council and the county. We have so many partners that came to the table to make sure that we were able to offer a vaccine to our residents. We know that the needle has shifted. There are many individuals who are certainly interested in receiving the vaccine. And so over the past few weeks, some of those partnerships have definitely come to bear. I'll start first with discussing the FEMA site where I currently am. We're partnering with FEMA. We have military here, of course, AmeriCorps, and also we're partnering with Orange and Irvington to provide the Moderna vaccine to our residents specifically in this area, and employees, essential employees in this area. And one of the wonderful things that we've seen since Sunday is that we've been able to administer over 500, actually closer to 600 doses of the Madonna vaccine. And we'll be here. We'll continue to be here through next week, providing vaccine to our residents. It is by appointment, and so residents of East Orange can communicate with the East Orange Health Department if you're interested in receiving the Madonna vaccine, and we will be able to schedule you for an appointment ideally between this week or next week. Another opportunity that we have based on a partnership is a growing partnership with NCHC. We're so appreciative to them as well because they also are here right in East Orange at 444 William Street, and they too have partnered with us to make sure that they can administer the Madonna vaccine to as many residents as possible because they do have a commitment to East Orange because of where they're located, as well as the municipalities where their other sites are located. And then, of course, we have our mobile health clinic that is available. We have partnered with the county, and we are still collecting information about residents who are homebound, because while we understand that there are a lot of residents that are able to leave their home and visit the county or leave their home and visit the FEMA site, there's some residents that cannot leave home, and we want to know who you are. We'd like to receive your information so that when we receive additional allocation, we can come to you using our mobile unit. And lastly, we truly appreciate the partnership with the county because we've been able to begin going into senior buildings and offering seniors within buildings at this time vaccine as well. And so there are several seniors who've been able to take advantage of that. And as we work and continue to partner and as Johnson & Johnson vaccine becomes increasingly available, we'll continue to do that in additional countries.
And Dr. Griffin, thank you. Dr. Griffin, if I could just ask, I know people, I see them on faith, they can't hear, and I know how important it is, especially for us to keep these masks on, and because I know you're out in the public, but if you can help us by just talking a little loud, because we want the people to hear the information, and I really appreciate you. I can't, as a man, I can't say take the mask off, because we keeping masks on, right? So listen, we know the governor has upgraded the eligibility requirements for the vaccination and the vaccine. Please break down who qualifies to receive the vaccine as of today, as of now.
Okay. All right. Can you hear me a little better, man?
Yeah, a little better.
Somewhat. Okay. Well, those who are eligible to receive the vaccine are those who are 65 years old and older. If individuals are between the ages of 18 and 65, if you have a chronic medical condition that would
vaccines.
Okay. So we've spoken quite a bit about the Pfizer vaccine and the Madonna vaccine, which are and have two-dose regimens. Madonna vaccine, those that are 18, and Pfizer, I believe, is 16 and above. Where Johnson & Johnson is concerned, the main difference that a lot of individuals are very interested in and happy about is that it's a single-dose regimen. So individuals can receive the vaccine one time, and that's it. So we've seen a lot of interest in the Johnson & Johnson vaccine, but we continue to tell everyone that we don't know what supply is going to look like. And so if you are fortunate enough to have access to even one of them, whether it's Johnson & Johnson or Moderna, it's so important to take advantage of what you have access to, because there are so many residents in the state of New Jersey that do not have access, and they certainly don't have the increasing access that we've been fortunate to see locally. And so regardless of what you have access to, we do encourage you to take advantage of whether it's J&J or Moderna, or even Pfizer for that matter. In our area, we're seeing more so the availability of J&J and Moderna. But in addition, we know that the general efficacy rates are still the same, where they both or all three have been shown to be effective at reducing the risk of severe illness. So again, whichever you have access to, it's important that you take advantage.
Right. So where do folks go who are eligible online to book a slot to get vaccinated, and where are the current sites? So how do they go online, give a number, and where the current sites currently right as of today? Because most people are very concerned about where do I go? How do I get online? So please explain that, Dr. Griffin.
Absolutely, and we've been talking to a lot of people here too who first registered on the state site because they wanted to be on the waiting list, and then they registered again on ethicscovid.org, and they may still be waiting. We do know that the county is doing everything that they can to provide support for residents of Essex County and employees of Essex County. And so ethicscovid.org is still a resource for you. But we have an additional resource as the City of East Orange where you can contact the health department. As I mentioned, FEMA is here, and we are all working together along with Orange and Irvington to provide several thousands of doses of the Madonna vaccine to our residents. So if you're interested and you are ready and you want to receive the vaccine within the next few weeks, you can feel free to contact the health department at 973-266-5480. And when you call, the health department does have representatives that will be able to provide or obtain information from you and pre-register you, and then also give you an appointment to come and see us here at this site, which is St. Matthew's AME Church in Orange.
Thank you. And listen, last week, I'm excited about it as the mayor, and I know the East Orange City Council is. Last week we launched our mobile health clinic to assist down the line with our vaccination efforts. Explain to our residents how the mobile clinic will operate.
Okay. We're excited about it. We are so ready to provide the vaccine to our residents, and we know that our seniors, some of our seniors were having a difficult time leaving in certain groups within our population, didn't necessarily have the ability to leave home and visit the either Essex County site or any other site that was available. And so what our plan is to utilize our mobile health clinic to go to the residents who cannot find any other way to get to other locations. And currently that population includes our seniors. It includes specifically our homebound seniors, other individuals who might be under the age of 65 or 64, and our homebound. We plan on going to you too. We're planning on also using it for the purpose of providing support to our shelters, as well as our homeless, because that's the one thing that we understand. We understand that it's not just always the individuals that you see and that are able to articulate or access the vaccine. So we want to go to the individuals and meet the need of everyone so that we all collectively can build our immunity against the pandemic, against the virus.
Right, and Dr. Griffin, also just give a small overview about, you know, our mobile health clinic. That what also we're going to be using our mobile health clinic for, other than right now our primary focus is this vaccine. But outside of the vaccine, what else are we going to be doing in terms of our mobile health clinic?
So outside of the vaccine, we know that we have multiple clinics within the health department, and what it does is this allows us to bring services to the community, directly to the community. And one of the benefits is because we do know that a lot of individuals either don't realize that we have the level of clinical services that we're offering, and so it allows us to bring screenings, it allows us to bring testing, it allows us to bring so many other resources directly into the community in different ways, not so much in brick and mortar facilities, but also in the mobile unit, and go into wards, go into neighborhoods and provide those services to the residents.
Right, and thank you. That look, one of the things I know that when they start giving out the vaccine, they went from all the essential workers, they went from the nurses, the doctors, the police department, the fire department. When are they going to start here in the city of East Orange vaccinating our school teachers, the professional people who are in the schools? When is that plan coming into fruition?
Now, so our educators within our school district are eligible now. The governor expanded the criteria, I believe, as of yesterday, and so all of our educators are eligible to receive the Madonna or Johnson & Johnson vaccine, whichever you have access to now. And
right.
So when you have sites that are indicating that they do have vaccine available, it's important for you to take advantage of it. It's important for you to schedule an appointment to receive it. And as I mentioned, we're here. We're right here in Orange. Even if you do not live in East Orange, but you work in East Orange and you're servicing our children, we definitely want you to take advantage of this opportunity over the next few weeks and contact us so that you can receive the Madonna vaccine as well.
Right, and that's important. So when do they talk about doing the students? You know, I know that from what we're hearing and watching on the news, and we're hearing our governor and our president that they want to get our young people back in school. When are we working on, you know, making sure that, you know, from grade all the way up to high school in terms of getting them vaccinated, our school age kids?
Okay. So we do know that right now, based on the research that was done, the trials that were done, adults, those 18 and older, are currently eligible to receive the vaccine at this point. But we do know that they have started trials on pediatric clients.
Right.
And so it still remains to be seen. We have to see what the research yields so that we have an understanding of the general timeline. But the premise at this point is that if all of the adults within the community continue to raise their level of immunity and increase the protection, we can basically create a hedge of protection around our kids and reduce their risk of encountering the virus. And so that's why there's still this larger push for the adults within the community to really take responsibility for the level of immunity that we see and experience within our community.
Right, and thank you for that. Now, what advice would you give to those individuals right now? Because people are still on the fence about getting the vaccine. What would be the best advice that you can continue to give these folks, and hopefully what you say tonight can push a person over that fence to go ahead and take the vaccine?
Yeah, I know that there is a lot of hesitance, or has been. We've seen such a drastic shift in the immunity, the the hesitancy and the desire of people within our community to receive the vaccine. For those that are still on the fence, though, I think that it's very important for everyone to really weigh the risks. We've seen what this pandemic can do. We've seen a lot of individuals become severely ill due to the pandemic or due to the virus. We've seen a lot of individuals actually still experience long-term effects and impacts of COVID-19, where, you know, to this day they're still experiencing some respiratory issues and some other complications. And so when you weigh it, it's important to weigh the risks. Can you afford, whether or not you know, because we don't know if we'll have mild symptoms or severe symptoms, and so it's important to weigh it and make a decision about whether or not you'll receive the vaccine. And we are truly encouraging everyone, because we don't know. You never know if you're going to come in contact with a strain that will lead to a more severe illness due to your exposure to COVID-19. So we do encourage you to really weigh it, and in the grand scheme of things, increasing your protection, hands down, is the most responsible way, or one of the most responsible ways that you can continue to contribute to this fight.
Right, and you know, listen, we've been preaching that for a long time. We're going to continue to just talk to people, give people the information. Every time we get information that is trickled down from your office to my office, we make sure that the community get that information, which is very essential, special in during these times. But let me ask a question. Do you think people are going to be restricted when this thing open up and they have to travel and they want to travel? You think that it's going to be mandatory for people to have these vaccines?
It's hard to say. It's really hard to say. So much related to the pandemic has been so unpredictable. And so where sometimes we think we know what's going to happen, we don't. But in a lot of the conversations that we've been having, we liken this pandemic and what life after the pandemic might be to the changes that we saw after 9/11 as an example. When something impacts the community and is somewhat traumatic, it's inevitable that life after will change. And so now the community at large is so much more aware of what's possible that, yes, I do think that there are going to be other expectations and standards implemented to make sure that we do everything that we can to prevent this from happening again to the greatest extent possible. Will it be a requirement? It's hard to say. It could be, but it also might not be. When we look at past experiences, like with influenza, there came a time where there was a level of immunity, and we were able to, the community was able to engage in a pattern of either receiving the vaccine, or they had a better understanding of how to fight influenza, or they had a better understanding of influenza. It didn't lead to, for everyone, it didn't lead to a requirement for everyone to have the vaccine, but by choice, individuals were able to make an informed decision, and there was a level of immunity also within the community that prevented the type of widespread and large-scale responses we're seeing now even. So I do think that with information and knowledge, we'll see some shifts in how we live, but we might not see that the vaccine is required for everyone.
Right. Well said. You know, listen, we've been pushing that message and just trying to make sure that, you know, look, people gotta have to make a moral decision without a doubt, right? And a decision that they make, again, it's a personal decision, and nobody can argue that. Listen, Dr. Griffin, we know you are up at St. Matthew's Church, and I'm not going to hold you too long, but I do want to share some information about the COVID-19 vaccination transportation service that we are offering in our seniors and disabled residents here in the city of East Orange. And can seniors where can they go to sign up?
They can. So our Division of Senior Services has really been working so hard to provide support to all of our residents. They've been providing support to our seniors, of course, because that's the population, the main population that they served even prior to the pandemic. But even now that we're in the pandemic, what seniors specifically can do is they can certainly use senior services as a resource, and they can call 973-266-8832 if they are in need of transportation to Essex County. Also, really, any of our residents that are in need of an appointment and transportation can contact our Division of Senior Services, again, at 973-266-8832, and work to reserve a seat on the bus to an appointment so that they can receive the Madonna vaccine. I do know that at one point appointments were limited, and sometimes that does change, so the best thing to do would be to call Senior Services for the most up-to-date information. Outside of that, we're also partnering with the Department of Recreation because we know that transportation is something that many of our residents have requested and need. So depending on what we're looking to do, especially if there's transportation to vaccination sites, our Department of Recreation has continued to make themselves available to our residents along the end with senior services.
Great, great. I mean, that is so important to know. If you can, Dr. Griffin, get that telephone number out just one more time, and then
Sure.
We're not going to hold you too long. We want to go to our phone lines. I know that folks have questions, and we're going to take a few questions, and then we're going to allow you to go back to your tasks in terms of getting people vaccinated. So get that number out one more time, Dr. Griffin.
Absolutely. The number is 973-266-8832. And that's the number for senior services.
Thank you. And again, if you're just joining us, this is Mayor Ted Green, and our panel tonight, we have Dr. Griffin and Victor Cote. This is our weekly town hall meeting. We thank you for joining us. And we're just talking about the vaccination tonight and the vaccine, and making sure that the community get the right information, the right telephone numbers, the right places to go, because what we don't want people to do is have misinformation. So we're giving out the health department numbers. Although we work as a team in the city of East Orange, you can call the mayor's office at 973-266-5151. As for Justin Brown or Ija Baldwin, we are going to be able to assist you. So with that, East Orange, Connie, can we go to our phone lines and some questions that's on Facebook so we can get Dr. Griffin to ask a few questions?
Yes. Janice Johnson would like to know, is ShopRite giving out the vaccine? And if so, do you need an appointment?
So we did learn that ShopRite is or does have an allotment of vaccine. In this moment, I don't know exactly how much or what their scheduling process is like. But generally speaking, most sites are going to only offer the vaccine by appointment only. So I would definitely encourage you to visit their website so that you can learn more information. Usually there is a tab of some sort or a banner that provides you with information on how you specifically can schedule an appointment with them. But yes, most sites that are offering the vaccine are going to do so by appointment only.
Okay, one of our Facebook followers, Carolyn Cornelius, actually gave out a number that I'll share for the ShopRite vaccine. So anyone who's interested, that number is 833-768-1216. Okay. Shalise Fuller would like to know, will this vaccine be needed yearly like the flu and pneumonia vaccination?
I wish that I could say. Research is still ongoing, so we don't know yet if this will be an annual need or if this is something that is, or if it's a situation where you only have to receive it once because the research is still being conducted and even those that were in the trials are still being followed. But they are watching to see how the level of immunity that is built due to the vaccine, how long it's managed and maintained to provide long-term protection. And so research and even the evaluation of that is ongoing. You're still observing and learning more about the long-term benefits of the vaccine. And so hopefully, within a couple of months, we'll know a little bit more about how long or what the frequency of a vaccine like this might be.
Okay. Dr. Griffith, related to the vaccination program going on at St. Matthew, Tashia Owens Muhammad would like to know what specific identification do you need to bring?
None. So what happens, and this is the wonderful thing about this site, we know in working with FEMA and working with the other agencies, governmental agencies and local agencies, there usually is some level of fear when it comes to verifying identity for some. And we're in the midst of a public health crisis, and each and every entity that is here is committed to doing whatever we can to just make sure that there's access to the vaccine. And so we don't want there to be any barriers. And that being said, there's information that you will provide when you pre-register, but you will not need to, at this location, provide any proof of identification. We're not looking for a government ID. We're not looking for insurance even. You just need to come and you need to register, and we will get you in and we will get you an appointment. Of course, the effort, this is only going to operate for a short period of time. It's a 2-week initiative, and then we will need to close. So certainly take advantage when you can and as you can.
Okay. Sheila Campbell-Smith would like to know, what are some of the side effects that someone can expect to experience after taking the vaccination?
Mm-hmm. They vary. Side effects vary, but what we've been seeing more so is that individuals might experience a headache. Others may experience fatigue. And those are the typical responses, and those typical responses for some have been experienced more so after the second dose and also have subsided within about 24 hours. Is that guaranteed for everyone? No, because everyone's body and makeup is different. But that's on average what we're hearing individuals are mainly experiencing. There are some who have experienced rashes or sensitivity at the site of injection, but again, that's time limited and temporary. We haven't experienced any long-term severe complications or side effects due to the vaccine here. Again, the main complications or side effects would be the headache, the fatigue, and sensitivity at the injection site.
Okay. Deborah Thomas would like to know, are those administering the vaccination from the health department, are they properly trained?
At the site, if those who are administering the vaccine are from the health department?
Right, and she's asking, are they properly trained? Are they certified?
Understood. Yes. Everyone who's administering the vaccine is a medical professional. At this particular site, we do have, again, it's a partnership with FEMA, so the clinical team, we have physicians that are administering the vaccine here. There are nurses who are here. There is no one who is an unlicensed or ineligible professional who will be offering and providing the vaccine to any of our residents.
Okay, maybe this would be a good time to mention the Medical Corps volunteer program, and then what number they can call if anyone is retired or interested in helping out and they are a medical professional.
Absolutely. And what I'll also say is the Medical Corps certainly falls in line with what the state standard is. The state has identified personnel and professions that are eligible to serve as vaccinators, and it's a list and it's by statute. And so entities that are serving as sites for vaccinations have to follow that, and that's something that's also monitored by our health officer. and the health officers in different jurisdictions are also the medical directors of the sites. Every site has a medical director. Every site has physicians on hand, as well as emergency medical service professionals in the event that there's a more severe reaction or significant reaction to the vaccine, which again we haven't seen, thankfully. But it's all medical professionals. If you are in the city, if you are even outside of the city and you're watching and you do have an interest in just volunteering and sharing your expertise, and you are a medical professional, whether you are currently active or retired, again, there's a long list. The state has allowed us to recruit. And so we are building and continue to build our medical corps. So you can certainly contact our OEM, and you can also contact the health department if you are interested in volunteering at 973-266-5480.
And thank you for that, Dr. Griffin. I know you're at St. Matthews, and I'm going to let Connie continue. What vaccine are they giving out at St. Matthews?
Here it's the Madonna Vaccine.
That's the Madonna Vaccine at St. Matthews.
Yeah.
What site?
And the way that it's,
go ahead.
I was just going to say the way that it's working is over the next few weeks, we're going to administer the first dose, and then we'll come back, and everybody who receives the first dose will, within that 28-day period, also receive the second dose here.
Great, Connie. You got another one?
Okay. Dr. Griffith, for teachers and teacher assistants, are they calling senior services for the vaccination, or is it the health department?
They would call the health department.
Okay.
You can call either, but I would recommend that you call the health department. We're also partnering with the school district. So if you are a teacher or an educator in the East Orange School District, we're partnering with the school district as well, and we continue to remain in communication with Dr. Harvis and Superintendent Hassan and Ms. Santos to ensure that any employees that are interested in receiving the vaccine, we are informed of, and they will register you also for, or pre-register you for an appointment. But if you are not affiliated with the East Orange School District and you are an educator that resides in the city, you can certainly contact the health department at 973-266-5480, and we'll pre-register you. I have staff that will pre-register you and schedule you for an appointment.
Which vaccine was the ShopRite giving out when they was doing the vaccine?
They're doing it. I believe that they received an allotment of J&J because the J&J vaccine is available in limited supply in different areas. And so we'll start to likely see an increase in the availability of J&J over time as production increases, but right now it's still in limited supply.
Okay. Thank you. Connie, do we have any more?
No, that's it for Dr.
And
Griffith.
Dr. Griffin, we thank you so much. You know, listen, we've been at this now for a year. You know, we've been at this for a year with the COVID-19 update and this meeting, and we went from, you know, again, the COVID testing to testing sites. Now we at the vaccination, testing sites, and vaccine. People taking the vaccine. And I'm going to let you go, but I just want you to give an overview, how important it is, although that we're still in this pandemic and we're still giving out the vaccine, how important for us to continue to stay focused, stay vigilant when it comes to this COVID-19. And let people know how far we're not out of it yet, and things can still happen if we don't stay in precaution.
Absolutely, Mayor. So we have progressed. We have moved from, as you mentioned, just learning about the virus to offering municipal testing or testing on a municipal level to now administering the vaccine. But the reality is we're not at the point where 100% or close to 100% of our residents are vaccinated, and what that means is that there are many individuals that are still susceptible to the virus. So we're not out of the woods. We're ramping up efforts. We're doing the best that we can for those that are interested. But we know that the population or those who are 18 and older are eligible to receive it. So that still leaves our little ones. that could also be exposed to the virus. And even if you have received a vaccination, it's still very important for you to mask. It's still very important for you to monitor how and manage how you're moving and if you're traveling and whom you're around until we develop a larger sense of immunity within the community. And so, yes, it's important to still wear your mask. It's important for you to still wash your hands and do all of the things that you were doing before, because even if it's not for you, it could be for somebody else, and it could protect someone else from contracting the virus. Those who receive the vaccine may lessen and reduce their risk for severe illness, but it doesn't mean that they can't be carriers. So we do have to still be mindful of that and continue to also work to protect others from contracting the virus.
Right, and thank you so much for that, Dr. Griffin. If you want to, I know you got to go. If you want some closing remarks, please do that, and then I know you can move on to your task with getting people vaccinated. And we appreciate everyone that is really on that mission in terms of making sure people get vaccinated. So do you want to close out with something?
Absolutely. You know, I do think that we have an opportunity here that a lot of others do not have. We see and we have seen what has been happening across the country related to access to the vaccine. And yes, I know the importance of, considering it and weighing options, because this is a personal decision, and I definitely encourage everyone to do just that. Conduct a risk assessment. Understand what might occur or what the risks are if you opt not to receive the vaccine compared to if you do opt to receive the vaccine as it's available now. There are communities that do not have the access that you have. And so while it's here, take advantage of it, because not taking advantage of it and the risks associated with that are so significant and can be significant. We're here. If you have questions, you're not alone in this. You've never been alone in this. The mayor has shown that. The council has shown that. And I hope you believe that the health department has shown that as well. So call us if you have any questions related to the vaccine, the process, registration, what any of this means, because we're here to support. And again, I'll give the number. You can call us at 973-266-5480.
Dr. Griffin, thank you so much. I know you got to go. We appreciate you. We appreciate your staff. We appreciate all those men and women who are up there at St. Matthews, who've been working with us at, over at Campus High School and at our local senior buildings. We really thank everybody for the teamwork that they're doing and trying to put a curve on this disease. So again, I know you got to go. Have a great night, but stay safe. And you already have your mask on, but keep the mask on. Right. So with that, everyone, we thank Dr. Griffin and Victor Cote. Even though Victor didn't have an opportunity to speak tonight, we are just so grateful for their expertise when we come on every week. But let me close out. Listen, Dr. Griffin gave you the scenario of where we at with the vaccination, where we at with the vaccination sites, and what's the telephone numbers, and what's the websites, and what emails you need to do to get on. And also she talked about our schools, the school district, where we're working with our superintendent and the assistant superintendent and making sure that our teachers and the staff and our students get the vaccination. And again, we all understand how important it is, and we have to make a personal decision. But we're going to do everything we can here in the city of East Orange to make sure you get the information, you have the sites and the places to go. Before I close out tonight, I just want to share some information with all of you. But I truly thank all the folks that come on each and every week who have been by our side and holding us up. We appreciate all of you for coming on and really just giving us your voice on Facebook or Instagram, and some of your concerns and some of your issues, and also some of the love that you show us during the last year. And we're going to continue to do that moving forward. But what I want to share, we're still continuing our food distribution here in the city of East Orange. If you know anyone, any family, any individual, please reach out to our senior service department, and we're going to do everything we can to assist and help our community, those who need something to eat. And we all know that is 90 Halstead Street, and that's between the hours of, right now, they're there 8:30 to 4:30. So if you need to call, please call that number and speak to Rita Butts, who is coordinating our food drive and working with our seniors over there. All right? So, and that number is posted. Also, we just want to remind you, East Orange, of that parking advisory, right? Please be advised that we have resumed our street sweeping schedule. We want to clean our streets. We want to keep our city clean like any other city. But we need your help, right? Now, we are currently enforcing daytime 9 a.m. to 12 p.m. So when you see that sign on your street, move your car, all right? So we can sweep our streets. And we also have overnight, where we're going out, you can't park between 2 a.m. and 6 a.m. It's on alternate street side of parking. So look at the signs, good people, and on Tuesdays and Thursdays or Monday and Wednesday, just look at the sign. We just actually, we're not in the business to giving people tickets. That's not what we want to do. What we want to do is work together as a community to make sure that we keep our city clean, and we need all of you to share in that and helping us keep the city clean. All right, so again, the enforcement is you have to have a permit, right? You have to have a permit. You get that permit, you're fine, but you still have to move your cars. It's important, all right? So let's work together, East Orange, on that. We can do it. I know this task wasn't easy for us. Nobody wanted to take it on, but we did. Also, if you get an opportunity, want to really honor all the women during Women History Month, I want to personally say thank you to all the women out there, all the women whose shoulders we stand on. We thank you for all your support. We thank you for your commitment. We thank you for your love. And we especially thank you for holding us down. And we know for a fact that the women of this community and this world are the backbones of what we do each and every day. And we love all of you. So this is your month. But to me, every day is Women History Month. So I will leave y'all with that. So also, for all of those who are, need free tax preparation, don't forget about our here in East Orange at our East Orange Library. But I want to give you a number. Let me give you a number that you can call where you can get your taxes done free. Save yourself some money. So if you are making under $64,000 a year with a safe option, now this is safe. We're still practicing safetiness. You can bring those documents. First call 862-241-9491, right? And that program is working under the MOET program, under LaDonna Johns. Connie will post that number. Call over there if you need help. Again, free tax preparation. We're doing everything we can to help. Now also, we have been really, really pushing this initiative. We know how hard it was for us during last year. Many of us who, when it came to our rents, we still have rental assistance for the community. I'm going to say that again. If you fell short during the time when this COVID started happening and you fell short of your rent, the City of East Orange, we still have rental assistance for those who qualify. So if you got behind because of the COVID, you got behind because your job folded, we have rental assistance. Please call this number. Let me give you this number. That's our Department of Planning and Development. 973-266-5140. For any information, all right, call that number. Also, the Health Department number, I'm going to give that to you again. 973-266-5480. That's the Health Department. Please call. The Mayor Office of Constituent Services, 973-266-5480. 5151 East Orange. Listen, we had a great meeting tonight, and we had a great conversation around the vaccines and the locations and the sites. And again, whatever information that we didn't provide, please call the office and we'll make sure that you get the information that you need. We also asking everyone to continue to stay safe. Continue to wear those masks, continue to practice social distance, continue to wash those hands frequently when you're touching things, even if you know you got the vaccine. Let's slowly roll ourselves back into some normalcy, East Orange. Let's slowly roll ourselves back into some normalcy. I know for a fact the weather's starting to change. It's getting warm. We just feel like we need to be out, and it's all right, right? But we have to do it in a respectful manner. We have to do it in a manner to keep yourself safe, your family safe, your friends safe, and keep the community safe. So until next time, East Orange, thank you so much for being that one city, that one community, and having that one goal, and that goal is progress. We thank you. We ask God to bless you. We ask God to bless your families. We ask God to bless East Orange. Thank you for tuning in tonight, and we'll see all of you